Good afternoon, everyone. My name is Brent. I'm the host for Canadians with Disabilities and Their Allies. And this afternoon, I have Christine Gibson, MD, coming on and talking about MAiD and the intersection of disability justice. Good afternoon, Christine. Thank you for coming on to my show today.
Hey, no problem. Thanks for having me, Brent.
Yeah, thanks. It's a great pleasure having you on and having definitely a good discussion regarding MAiD and definitely there's lots to talk about and kind of dig through on that.
Yeah, and I'm hoping I can shed some light on some misunderstandings, but I certainly don't think I have all the answers. I've got
No.
some opinions.
Yes.
I can share it as like an individual and just my experiences, but there's still a lot of unanswered questions.
You know what people are going through. Like, what are you hearing when they come to you regarding it?
So I'm a medical doctor, and in 2016, in July, the federal government was forced to create legislation to allow medical practitioners, so physicians and eventually nurse practitioners, to facilitate a medically assisted death. So, what that means is that the patient is asking for it, and we have the legal rights to facilitate it now as per their wishes. And this came about because patients were challenging the system and saying, you know, you're giving me the right to take medications, but you're not giving me the right to choose my own death when death was inevitable. So the original legislation around MAiD came from court cases that were based on palliative or life limiting diagnoses. And so in 2016, this door opened up and very few physicians stepped through because it seemed really scary. Like, for one thing, we're told do no harm. And so doing an assisted death sounds like you're really harming somebody for, perpetuity. But also, there were just so many questions like, how does this work? And what are the hoops to jump through? And lots to learn around, the legal aspects and new medications you might never have dealt with before. So many people were really reluctant to jump into providing MAiD. So I was the only provider at my hospital at the time for over a year after the legislation came to pass. And we're talking 400 doctors. So that's gives you a bit of a snapshot as to how few people actually were willing to jump in. And of course, there's also some conscientious objectors, which is totally valid. You don't have to do anything you don't want to do. You just have to make sure your patient can access a full gamut of care that they are requesting. There's been lots of growth and more people understanding how MAiD works. And there's also been subsequent court cases. So there was a woman in Quebec who fought for the right for a MAiD death. She was in her 90s, and her only medical diagnoses were arthritis, something that would never actually kill her. But she said, I should still have a right to choose. This arthritis is so painful that I don't want to live anymore. I'm in my 90s. My, death is reasonably foreseeable. And the Supreme Court granted it to her. But what they ended up doing is they said, we're going to widen the scope of practice for MAiD, but we also are forcing the federal government to consider mature minors, mental health, and chronic disease. And so what happened in March of last year was the federal government put down the legislation that would allow MAiD for chronic disease where you don't have a life-limiting diagnosis. And we call that a Track 2 case. And what is brewing is what they're going to do around mature minors' mental health, which includes dementia and advanced directives. And this is, everything has started to get a lot more gray for a lot of us in practice with Track 2, and it's becoming more and more gray. I think when it's a palliative case, as a physician, it's so clear to say, gosh, I can alleviate this person's extreme suffering and they're not responding to the medications. And, I could really help them by fast tracking this death. But when it comes to these more complex and comorbid issues, it gets so much muddier. And that was where you found me, was kind of taking a bit of a stance saying we need to have this discussion.
Oh, absolutely. Having people understand what, what MAiD is all about. It's not easy, right? Making awkward decisions sometimes when when they're not really offered the financial supports that they need to better to help them with their life the best way possible, or the supports that they need, and then they tend to think that they have to turn to MAiD as a solution, where the government has a legal responsibility to take care of its citizens, and sadly, they look at MAiD as a alternative, and it's sad, right? I mean, if people are going through illnesses in their life, I lost my mother through MAiD, but she was very ill at the time, so I understand that. At first, I didn't know. I said to my aunts about it, and of course they didn't want to talk about it, but I know that's what she had gone through. But and rightfully so, doctor. And but when people were they're having to look to a maid because they're not getting the proper supports or financial supports, it must be very awkward for you as a doctor. I'm not sure. Maybe you could maybe answer that, like your view on that.
It's a big question, and I don't necessarily know that I can answer it succinctly because every case
Yeah.
is so different. So I can say that the track 2 cases that I've approved, I've had a little bit of discomfort around people not necessarily having the resources to access absolutely everything. But I mean, when we're talking absolutely everything, that would be like going down to the Mayo Clinic and spending $10,000 to see all their specialists. And I mean, that level of everything isn't accessible to most people. So, what's that foundational baseline level of support that all humans and certainly all citizens of Canada should have access to? And I think you hit the nail on the head around finances. So, we should have a universal living wage that allows people access to services like rehab and equipment and housing that's accessible and appropriate and acceptable. And in my mind, mental health, because even though I'm a family doctor, a lot of my practice is a mental health trauma practice now. And I understand that there's tons that can be done for folks who have significant mental health challenges, but most of the really good therapy costs 250 bucks an hour. And on AISH or any kind of disability income, you just can't access something like that. And that's what really upsets me is we should not be offering MAiD unless we're offering these basic, fundamental physical and mental health and social health rights that all humans have. And I think we're really missing the boat. And that's why I can really understand disability allies. This is unsafe and unethical.
I totally agree with you on that. The supports definitely should be there for people, to at least give them that comfort in their life, the best way possible.
It's not a dichotomy. We shouldn't say, let's get rid of MAiD because there's this risk of vulnerability. But we have to work really, really hard to advocate for adequate resources in parallel to making sure that MAiD stays safe. And there's been big instances in the media where there have been some unsafe practices. And I can see why people would be feeling scared if that's what they've been hearing. But I just want to make one small correction. This wasn't the government or the medical system that made track 2 MAiD happen. This was, again, patients. A patient in Quebec took her case to the Supreme Court, or to the highest court in Quebec, to say that she wanted to have a MAiD death even though she didn't have a palliative condition. And when that case was allowed, that forced the hand of the Supreme Court to say, okay, now you have to change the federal legislation around it so that this is a legal thing. So track 2 deaths were also forced by patients on the federal government and the medical system. So it wasn't something that was created out of thin air. It was based on legislative precedent. I know there's a lot of fear saying that the medical system or the government is trying to get rid of people with disabilities, and I can't argue that the system is ableist because I see that every day. But in terms of the origins of where this came from, it did come from patients. And my personal experience with track 2 patients, because I have seen a few of them, not one of them, well, that's a bit of a lie. One of them might have had a slightly better quality of life if they had had a higher income, but I still think they would have made the decision. But everybody else, it was a function of pain. It was uncontrolled pain. It wasn't that they couldn't get the resources that they needed. Their day-to-day pain was so overwhelming. Nothing they tried worked, and they just couldn't see keeping going with the amount of pain they were in. So when you say track 2 shouldn't exist, I would want some track 2 patients to start getting out there and actually telling their stories, because the story of a person who is allowed a track 2 MAiD death would break your heart. And most of them are not doing it on the basis of being houseless. Most of them are doing it on the basis of having absolutely irretractable, horrifying pain. And in that scenario, I do think it's ethical. In the cases I've seen in particular, these folks had tried everything and they still said, my quality of life is so bad, I can't take it anymore. So I've actually never seen or even heard of somebody who's asked for MAiD regarding the conditions of having insecure housing. And I'm not to say that it couldn't happen. And I can understand your fears about how it might. It's just not something we're seeing on the ground.
I'm sorry. I just want to pop in here very quickly because I'm so sorry. I don't mean to dominate the conversation, but there are clear cases where that's the truth, because CTV has published 2 news programs, one of Sophia and one of Denise, where they were both victims of MCS. Is that what it is? Multiple chemical sensitivity, where they just could not afford their housing. And Global TV produced the story of both Les Landry and Joni, where they are in such dire straits and the CDB is not going to cover, or the Canada Disability Benefit is not going to cover seniors. There are stories out there, and Mitchell, who comes into this room on a regular basis, is going to apply for MAiD in March because he is facing homelessness then. And so and he has been on W5 and he's been on the radio. So these are stories which are hard to miss. Do you know what I mean? And so, you're up for some work. If you catch my drift. And these are clear poverty situations. There was a study that was published which referenced time between 2016 and 2018, which indicated that it was published by James Downer. And it said that MAiD was not being used for poverty situations. But since then, we've had a pandemic. And since then, we've seen a 32% spike in MAiD. And so, whereas track 2 has been used for pain purposes, and I get it. I do. I suffer from rheumatoid arthritis. I am in constant pain. If I was that 90-year-old, I would be like, this doesn't seem like such a bad idea. At the age of 90, that makes a lot of sense to me. But I'm not 90. I'm young and I'm thriving and I'm a bit stubborn. So I've decided I'm going to actually win the day. This is the thing. We need to have case sensitive people who are asking us about our trauma history, as opposed to asking us, what kind of cash do you have on hand? And do you have any jewelry? Those are the questions we're being asked when we apply for stuff like OW. We're not asked sensitive questions. That's not how this works. The system works constantly against us. And not only that, but politicians know. They publish this material. When the PBO report came back on MAiD, it talked about how much money MAiD saves the healthcare industry. It is appalling. It's incredible how the system just wants to neglect. I mean, it's appalling. It is appalling.